This program is brought to you by Emory University.
Ebola virus is an infectious disease by a virus which is part of a group called hemorrhagic fevers because patients who have severe illness hemorrhage from multiple body sites. Unfortunately, as of this date, there is neither a vaccine or a treatment which is FDA approved for the care of patients who are infected with this virus. The main reason that we know we can help them is because the primary care for somebody with a hemorrhagic fever, and specifically with Ebola, is supportive care. And we know that we can deliver a substantially higher level of care and a substantially higher level of support to optimize the likelihood that those patients will survive this episode. When we talk supportive care, we talk about the same kind of supportive care you would get if you had a severe bacterial infection or some other complication and were in an intensive care unit. We're talking about maintaining blood pressure. We're talking about supporting respirations up to including a respirator if the condition becomes that severe. Patients with Ebola virus infection may have kidney failure, and so we are potentially talking about dialysis. But basically, we depend on the body's defenses to control the virus. We just have to keep the patient alive long enough in order for the body to control this infection. We have a special containment unit which has been developed with the assistance of the subject experts at the Centers for Disease Control and Prevention, which is capable of delivering any level of care in an environment which is safe and with a skilled group of nursing professionals who are used to taking care of patients with this degree of illness. We don't believe that there is any likelihood at all that there will be any secondary cases as a result of these patients coming for their medical care to the United States. From the time the air ambulance arrives in the metropolitan Atlanta area, up to including being hospitalized at Emory University Hospital, we have taken every precaution that we know and that our colleagues at the CDC know to ensure that there is no spread of this virus pathogen.
For the last 12 years, in conjunction with the clinical isolation unit here at Emory University Hospital, our special EMS transport team has had an opportunity to provide the appropriate education and training for a select number of paramedics, to identify the appropriate policies and procedures that would allow for the safe care and safe transport of those patients, to develop procedures for use of personal protective equipment or disinfection of the ambulance, to coordinate properly with the clinical isolation unit for the transfer of that patient. And through drills and exercises over the years, we've developed our competencies, and we feel confident that we can do this job well.
You can think about HIV, hepatitis B, hepatitis C. All of these viral pathogens are spread by close contact with body fluids and blood. So in the context of this episode, as I mentioned, we have a specially designed unit which is highly contained. We have highly trained personnel who know how to safely enter the room of a patient who requires this form of isolation. We have control over everything coming out of the unit so that everything is made non-infectious before any materials come out. And then on top of that, all of the items which are disposable go into our regulated waste stream the same way any patient in isolation would have in this facility. So the bottom line is we have an inordinate amount of safety associated with the care of this patient, and we do not believe that any healthcare worker, any other patient, or any visitor to our facility is in any way at risk of acquiring this infection.
The preceding program is copyrighted by Emory University.